cell affects every organ in the body. People with sickle cell anemia have a higher risk of getting strokes. And if you think about it, if those cells go and get stuck in the vessels of the brain, that's it. So if they come with symptoms of a stroke, you need to be thinking, is this their sickle cell? They can have what we call a chest crisis, acute chest syndrome, which is the highest cause of death in sickle cell anemia, where the red cells go and get stuck in the lungs. And so they come to hospital and they look like they've got a pneumonia. But if they've got sickle cell anemia, they are probably sickling into their chest. They can have problems with their vision. They can just be unwell. They could just be septic because they're at risk of that. That's what sickle cell looks like.
Affinity Xtra, be extra. Hey guys, this is your boy here, Roger Mohan, Affinity Xtra, celebrating gospel music of black origin, but we're here with an NHS special. We again with another specialist from the NHS, and you know what, guys? We're proud to be black and all this, but I am totally amazed and honored to be around so many black professionals, and I'm alongside one today, and I am gonna do a splendid job as announcing the name. Is Dr Kilali Ominu-Evbota. Yo, I'm getting there. So I'm not getting excited. Right, yeah, got it right. You know what I'm saying? But I'm alongside a doctor who specializes in a very, very serious condition. Something that I heard growing up. It's not me, so I don't have to worry about it, But it is a chronic illness. So it's quite scary. There's a particular gospel artist that some people may know, Xtra, who has gone a journey with sickle cell. But I'm going to get the doctor to introduce herself, and I'm going to hit her from my perspective, and she's going to hopefully push me the right way, yeah? So doctor, just introduce yourself and your background.
Okay, so thank you very much. It's an honor to be on your show. Yeah. So my name is Kilali Ominu-Evbota. So I'm a paediatrician, which means I look after children from 0 to 19, roughly. And if they have disabilities, we can push it a little bit. I am a specialist in hemoglobinopathy. So that's conditions that affect the red blood cells. You could say hematology. I also look after children with cancer, and I do a bit of allergy. So I'm a consultant in pediatrics with a special interest in hematology, oncology, and allergy. I'm also a mother, I would say, of 2 young people. I've got 19-year-old twins, a boy and a girl. Yeah, I love children, and so I work with children, and that's what I do.
So, guys, I'm gonna give you my how I approach sickle cell. Now, growing up, I'm saying to you, doctor, sickle cell was a disease that affected black people only, as far as I know. The benefits of having sickle cell, I remember hearing, is that you don't get malaria. And you can tell me off for that one, isn't it? Is that true?
It's. I think it's a bit of a myth, because you can get malaria. If you have the sickle cell trait, you may get some protection because you've got a normal hemoglobin and an abnormal one. But if you've got 2 abnormal ones, which is with sickle cell, then the malaria can be fatal, actually.
Oh, okay. So we dealt with that myth there, guys. So if I'm the only one in the whole world that thought that, which I doubt, because I know if I heard it as a child,
people say it. Yeah, people say it. But the reality is, especially if you live in the UK and you've got sickle cell anemia, and you're traveling to a malaria endemic region, you have to take malaria prophylaxis as well. Because malaria affects the red cells, and you've already got a problem with your red cells. So having malaria on top of that can be fatal, really. It can make you really ill.
That's great to know. I thought it was a natural mutation of that. So is that a truth?
When you look into the history of sickle cell anemia, where you try and look at, there's a whole science that looks at the history and the origin of illnesses or diseases. There is a thought that the whole, because if you look at the map and look at where sickle cell anemia traditionally, where the ethnicity can be traced back to, it's areas that are, so West Africa, amongst other areas in the Caribbean, they're areas that are malaria endemic. So there's a school of thought that this whole sickle cell was the body evolving to try and protect itself from malaria, and then somehow along the line develop this sickle cell or this sickle gene. So sickle cell anemia is a condition that affects the red blood cells. It is something that you see mostly in people of Black Afro-Caribbean descent. The way I describe it as a paediatrician is when we take your blood, it looks red. So inside that red blood, we have different cells. We have the red blood cell, which gives it the red color. We have other cells like the white cells that help you fight infections. We have the platelets that help your blood clot when you have a cut. But focusing on the red blood cell, that's where the sickle cell disorder is. And then if you zero in on the red blood cell, there's a molecule there called the hemoglobin molecule. Hemoglobin, HB, so Hotel Bravo for short. That is where the actual problem is. And so we all inherit two genes from our parents to form hemoglobin. The normal gene is the A, and then abnormal ones include the S and the C. Those are the most common ones, but there are other rarer ones. And so if you have, as a person, if you are AA, whenever you have a child, you can only pass on an A gene.
Okay.
And if, as a person, you are, for example, AS, which is the trait or carrier state, then you could pass on an A. It's a bit like a lottery or throwing the dice.
Okay.
You could pass on an A, or you could pass on a C, or if you're AS, you could pass on an A or an S. So if two people who have an S gene, which are the carriers or the traits, so for example, AS and an AS have a baby, they can produce some babies that will be AS, they can produce some AAs, but they can also produce some SS babies.
Right.
And that's where the problem is. The same way if you have an AC and an AS, you can produce some SC babies. And so the sickle cell disorder means you have no normal hemoglobin molecule. So there's no A. Once you have no A, then you have problems. So the typical patients that we see in our clinics are hemoglobin SS. So that's sugar, or SC, sugar, what's C, Sierra. Yeah?
Wow, yeah.
Okay. And what we find, going back to malaria, again, I don't have the hard data, but if you are AS, there may be some protection because you've got one normal gene and then you've got the S. But if you've got two abnormal genes, then you really don't get any protection and you get the whole sickle cell disorder as a problem.
No, it's good to talk about this, guys.
That's the postulation that may be how that gene came about. But
But no. That's great. So, guys, you got little information there. Now, you said about the West African and so you said about the Caribbean, but also you're looking at the guys in Brazil as well, because the population of Africans is in Brazil, outside of Africa. So I think they're fifth in the ratings of the highly populated countries with black people in it, and they're majority West Africans as well. So I can imagine sickle cell is a condition that they are fighting with.
We know that in the UK there are about 15,000 people and increasing with sickle cell.
So you could say,
it's comparable to, if you've heard about cystic fibrosis, which we commonly see in people of white Caucasian descent. It's comparable to the there are actually more people with sickle cell anemia than cystic fibrosis. Yeah. If you look at the population, I think the last time we were about 60 million in the UK. Right?
I remember when my 3-4 generations of my family, we're clocking at 70 people. Yeah. So that's just one family. One of us will have sickle cell, So that's quite scary. So, we're looking at this raising awareness of sickle cell. Yeah. Now you're on a station that promotes that's communicating to black people. And have we got lazy as black people with talking about sickle cell, do you feel? Is it something that we don't talk about, because I'm thinking, hold on a second, really and truly, we need to wake up about this. We gotta sleep on this. Is that something that you would say?
Yeah, so we're definitely not talking about it enough. But I wouldn't say we're lazy. As a black race, people of black ethnic origin tend to not talk about their medical illnesses. So there's still that, what's the right word? But so most people don't talk about their illnesses, and families try very hard to make sure that no one else knows that you've got this condition. Stigmatization, that's the word. So the fear of being stigmatized, and I've had families where we make a diagnosis. So first of all, sickle cell is diagnosed on the Guthrie card. So that's one of the good things that the UK has done from years ago is, there's a 5-day blood spot test that all babies born in this country get. And sickle cell is on that card. So that when you have that blood spot, if you have sickle cell, or even if you're a carrier, the result goes back to your GP. But then for those of them that have sickle cell anemia, somebody who looks after people with sickle cell anemia like myself, or the hematologists in the tertiary hospitals, will get a message to say, baby X was born 2 weeks ago and their blood spot has come back with sickle cell anemia. And then we go ahead and make contact and start to do all the things that we should do. And we've had cases where our community nurses go in to say, really sorry, it's not great news. Your baby has sickle cell anemia. And they're told, please don't let my mother-in-law or my mother or my sister who lives with us know about it. You're not allowed to say those words. So you can come and do a visit and look at the baby, but nobody else needs to know this. So there's still, and that is a big problem. So then these children grow up, they're not allowed to talk about it. Nobody in their church knows they have it. Even at school, I mean, we insist on putting care plans in school because it's in the child's best interest. So people don't share this information, and I think that's where the big problem is. So as a black community and families who have sickle cell anemia need to be talking about it. And if you look at any other medical condition, it's people who have the condition. I always say with cancer, everybody talks about cancer to the point where if somebody says, oh, my dad has cancer, you know how to respond to that person. But if somebody says, oh, my child has sickle cell anemia, people are like, what does that even mean? How do I respond to that? So yes, it's not laziness. It's that, I think maybe it's cultural, I'm not sure, but for some reason, people don't talk about it and they need to talk about it more. And that's what this is all about.
No, 100%. And like you said, I remember growing up and myself, I got epilepsy, and that was a
taboo.
Generational, and they don't realize if you don't pass that information on to the next generation, it doesn't prepare them. And I had a bit of that because nobody told my mom, this and that, and even a situation when and maybe we can go into this a bit later. The extra kind of like complication that you do have is something called thalassemia as well, which kind of mixes in with sickle cell. I don't know if you touch into that as well. Problem where I got Mediterranean blood in me as well. So I got a double whammy. And I remember I said to my nan, have you got thalassemia? And she goes, my blood is good.
And they almost feel guilty that they've passed this on.
They don't want nothing to do with it.
The reality is, it is what it is. So thalassemia is another condition, but it's also a hemoglobinopathy. So it also affects the hemoglobin molecule. And some people can just have thalassemia, which again you see more of commonly in Asians, people of Asian heritage, people of Greek, Mediterranean heritage. But you can also have sickle thalassemia. And those children come under our sickle cell clinic. Yeah, you can.
Wow. And you know what?
That's a whole, it's a whole different ball.
And another curveball that I had before I got married is that we got checked, our blood got checked to see who's got the trait. And if we both had thalassemia, it's a serious question. Are you going to have children? Because the children could be chronically ill. So this is a serious topic.
And that's what our role is. So the clinic I had this morning is a transition clinic where we see teenagers who are getting ready to go into the adult medical service. And the adult service is very different from the paediatric service. In paediatrics, your parents speak for you, they hold your hand, you can bring your teddy to hospital. Adult medicine, parents get shocked when once your child turns 16, they have to, on the phone, your GP won't speak to the mum anymore. They'll be like, can we speak to the patient? So the transition clinic is for every chronic medical condition has a transition clinic to prepare these young adults for the adult world. And one of the things we do in our clinic is we have a young people's assessment where we just go through the whole thing. The way I look at it is when the child's born, we teach the parents about it. And the children, a lot of them just go along. They don't really know why they do the things they do.
Okay.
But they go along. And so in our clinic, we then look at it like telling the children about it from scratch again and saying, this is your condition, this is why you have it, this is why we do what we do. But also one of our big questions is, you now carry that gene. And so if you have a baby with somebody with the traits who will look well and not have the condition, you can then go on to have children with sickle cell anemia. And like you say, it's about informed decisions. They need to know that this is what can happen. But what we also find is that their siblings don't know that. So for every child or person who has sickle cell anemia, a few of their siblings will most likely be traits. They will have the traits.
Wow, true.
They don't have sickle cell anemia, but if they go on and have babies with people with the trait, they'll go on and have.
Cool.
So it's important that people know and make informed decisions about what they're doing. In this country, all women will get screened when they're already pregnant. Men, not so. So, if a woman's screening comes back that she's a carrier or a trait, then they'll ask you, what's your partner's genotype? So it's so important that you know what you're doing before you go in.
Yeah, no, that sounds really, really serious. And I know we've talked about, the traits and the A's and the S's. So what does sickle cell look like on a day-to-day basis? Because I know people got sickle cell and I look at them, they look like me and you. You know what I'm saying? They don't look like they got any issues. You just hear one day, oh, they're sick at home because they had a crisis, and you're going, what does that look like? So for me with epilepsy, I would have a physical seizure. If that'd be technically my crisis.
Exactly.
Whether it'll be a shaking or unconsciousness or whichever way it reflects itself, freezing or whatsoever. So how does a crisis look like?
That's a good question. So we've talked about how you get sickle cell and what's going on, and just stepping back a bit. So under a microscope, all our red cells look like donuts. Little donuts. Try and imagine that with a nice dimple in the middle. And what it means is they can get through all your blood vessels nice and easy. So your blood goes from head to toe and your red cells go from head to toe, supplying oxygen as they go along. Now your sickle cells under a microscope, what I say to children is it looks a bit like a banana, so it's curved. It's lost its round, beautiful shape or the normal shape, and it's now taken on a curve, which sickle comes from. The days when sickles were used to harvest rice. Most children haven't seen a sickle before. So I say it looks like a banana cell, a banana shape. And so what happens is that banana shaped cell can then get stuck as it's going along. And that's literally that's what leads to a crisis. When I'm doing my talks, I encourage people to think about the word crisis, and people think, war, catastrophe, people have said, trouble. And I'm like, it's important to remember, even as healthcare professionals, that when a patient with sickle cell anemia comes in a crisis, every crisis they have can lead to death. There is always that risk. And so people need to treat it like that. So going back to your question, what does a crisis look like? The commonest crisis looks that you can see is pain. So those little sickle-shaped, banana-shaped red cells go and get stuck in vessels. Typically hands and legs, but it could be anywhere. So the commonest crisis is a painful crisis, and they just have pain. And it's not because they've hurt themselves, it's not because they've broken anything. A lot of times it's from doing nothing and they suddenly have pain. And this pain is really, really excruciating. And quite often, simple analgesia like paracetamol and ibuprofen doesn't make it better. One of the things I like to say, and I need to patent the phrase, is respect the pain. So sometimes as clinicians, when they go to hospital and they say they're in pain, because then at that point they need opiates, so things like morphine to sort out the pain. People think, oh, they just come for the morphine, which is terrible, because most of them don't want to come to hospital.
Hold a second, guys. Wait. You just said to me, I have to pause it here, yeah? Right. So paracetamol, Anadin, and ibuprofen don't work on the pain. So hold on a second.
Sometimes they do, but most times not.
They don't. So that's my first reach, yeah? And not even, and forget Carpol, yeah? And you just said morphine, which for me
what we use. Yeah.
is what you use when you're on the battlefield, when someone's been shot in the leg. And
exactly.
So why are you using morphine?
Well, because that's what can deal with this kind of pain. So these children and these patients they have pain care plans, and they're so good. They will, before they come to hospital, they would have taken paracetamol, ibuprofen. Some of them have a bit of codeine at home. They'll take all that, and sometimes that's enough. They can manage themselves at home. But when they come to hospital, it's usually because they've taken all of that, and this pain, they're still screaming in pain. And so the next step up is morphine or opiate type medications. And sometimes we give that. So a lot of times we try, in our centres, we give it orally, so by mouth, but sometimes they need to have an infusion, a drip, where they can, have it. And that's the only thing that can settle that pain. So pain is the biggest thing. And like you said, they might have gone to school that day, they might have just had a normal day, and they suddenly wake up screaming in pain, and they end up in the hospital. So yeah, that's what sickle cell looks like. So that's the commonest presentation. Oh, man. And that's the biggest burden is the pain. So I always say, when I'm teaching younger doctors and medical students, respect the pain. If they say they're in pain, you gotta respect the pain. You need to get on top of that pain. Yeah. And every hospital will have a protocol to deal with. They should have a protocol. Some patients have their own protocol. So if they've come in, maybe they have an allergy to the morphine that we use, then they'll have their own special protocol. And that's what the NICE guidelines recommend, that they should have a protocol so that people can just be like, okay, Kilali's coming, this is what she needs. The other things, and again, the way I teach it, sickle cell affects every organ in the body. People with sickle cell anemia have a higher risk of getting strokes. And if you think about it, if those cells go and get stuck in the vessels of the brain, that's it. So if they come with symptoms of a stroke, you need to be thinking, is this their sickle cell? They can have what we call a chest crisis, acute chest syndrome, which is the highest cause of death in sickle cell anemia, where the red cells go and get stuck in the lungs. And so they come to hospital and they look like they've got a pneumonia. But if they've got sickle cell anemia, they are probably sickling into their chest. They can have problems with their vision. They can just be unwell. They could just be septic, because they're at risk of that. That's what sickle cell looks like. But on a normal day, sickle cell looks like you or I. And I think that's part of the problem. Because they can pass, as, anyone else, people often don't recognize that actually when they do become unwell, they can become unwell really sickly. So the NHS England has recognised sickle cell anemia. That there's a recognition that these patients aren't treated as well as they could be.
No, it's because we look at things like sickle cell and they see COVID. Which is one of the things that people did say when they saw COVID. They said, hold on a second. On a fine, sorry the phrasing, on a fine, the COVID cure or vaccination in a matter of a year, but yet we have sickle cell for how long? And you ain't even give me a good enough pain medicine for it,
But that's why we're doing what we're doing.
Yeah.
People talked and screamed about COVID, and that's the way it works. So people need to talk about it. People need to be aware. So all the cells start off as a round cell, but the sickle cells quickly get sickled.
Sickled, yeah. Brilliant. No.
In the crisis, they're all clumped together.
Yeah.
I talk about it like plumbing. You're plumbing at home. If you have an obstruction in your piping, then and the water keeps coming. Where the obstruction is where the pain is.
Yeah, exactly.
And the bits beyond that, the blood's not getting there.
Correct.
So we need the blood to flow.
Yeah. No.
So that's putting it really basic. Yeah.
So, no, it's absolutely great. So, okay, we do have somebody around us who genuinely has got sickle cell, and we don't know nothing about it. So this is please, guys, use this. Hopefully, this podcast will be education, not only for myself but for yourself as we go through this journey. Before we go into how we can support sickle cell organizations and what elements of the NHS is connected to, is there any secret tea? Turmeric tea or something like that, so that we can have herbal like green teas or anything like that?
No, none at the moment that have been validated and that work. You know, from time to time, we, again, in our clinics, I'm sure people will mind me saying, people go abroad and say, oh, somebody told me about this and I'm trying it. And it's all well and good as long as it's not causing you harm.
Yeah.
But nothing at the moment. Because we're also keen to, if there is something, we want to know and we want to validate it. We want to then test it to see that it does what it says it does. But no, not at the moment, unfortunately. No. So when you talk about a crisis, and we've talked about what that looks like, we talk about the triggers for a crisis. And the triggers are, so sometimes, unfortunately, no trigger. A crisis would just happen in what the person thinks is their best situation. But there are common triggers. So if you've got any infection at all, so in little ones, you know, the way I put it is everyone at home might have a cold, but the person with sickle cell anemia can't shift that cold and then can go into a crisis. So their usual childhood illnesses can cause a crisis in somebody with sickle cell. Dehydration. So if they're not drinking enough, and these children are so good. From day one, they're told you need to drink. So they're very good at drinking. But if they're not drinking enough, that can cause a crisis. Extremes of temperature. So when it's very cold or when it's very hot, we've now started having very hot summers, and we had quite a few patients come in with a crisis in July when it was really hot.
Serious?
Typically, yes. Typically, it's when it's very cold, and my patients will say, oh, they went swimming, the pool was cold, they came out from the pool, and then that night they started having pain, So typically it's when it's cold, and we have care plans in school. So some children, the parents will say, don't let them go out in the snow, because the last time they went out in the snow, they ended up in hospital. So those are the common triggers. And so when you're talking about looking after people with sickle cell anemia, those are the things we say. Keep warm, always have a jacket with you. In winter, wear your thermal wear, and the children will often be fighting with their parents about having thermal wear. But, keeping warm, keeping hydrated, treating infections aggressively. So if a patient with sickle cell anemia gets a cold or a cough and it's not clearing, you need to see your doctor sooner rather than later, and not wait for it to, become into something bigger. But there's a new NHS training program that's available online as well for sickle cell anemia, so that people can go and have a look if they want to learn more about sickle cell anemia.
So I like fitness and so on. Like, say I'm playing football, and I play with a lot of energy. If I had sickle cell, would that be a concern?
That's a very good question, and it's a question that I often get asked by parents, but also by young people. So some form of exercise is good for everybody, including people with sickle cell anemia. And so what we say is about knowing they need to know their own limits. Cool. So my biggest example is when I first started this job in this role about 5 years ago, children would come and say, so they'd come into hospital with a crisis, and when I tried to say, so what's changed? They'd be like, oh, we did cross country. I think that's what it is at school. And I'm like, okay, did you tell your teacher that, this might be too much for you? And they say like, oh, the teacher said I should do as much as I can. And what do little children who, like all of us, you don't want to be seen as different. They complete the cross country. That's not a problem. And then they go home and then they have pains and they end up in hospital. So it's about pacing yourself and knowing your limits. And if you start to feel those aches and pains, stepping back and saying, actually, if everybody else is playing football 3 times a week, I might just play football once a week. But exercise is encouraged, but it's pacing yourself and knowing what the limits are. Having those extra, make sure you have your water bottles, having extra water, good nutrition is important for everyone. So yeah, I have some patients that play basketball and they're fine.
And they're fine, yeah.
But they pace themselves.
Pace themselves, yeah.
Pace themselves,
wow. Yes. I know we're not doing it on epilepsy today, guys, but some of these things apply for me for epilepsy. But you know, when it comes to alcohol and smoking, and basically, you know, when people just want to say, I want to relax, you know, this will help me calm my nerves and whatsoever.
And that's normal.
Yeah, you know what I'm
so
saying?
It's interesting because the clinic I had today, which was my transition clinic with teenagers, in our questionnaire, one of the boxes talks about health and talks about there's a question that says, I know the effects of alcohol on sickle cell. I know the effects of smoking. I know the effects of drugs, illegal drugs of abuse. And what I say to them is, so what does alcohol do to you when you drink it? A few of them said it makes you
relax. Yeah.
Not relax, but alcohol dehydrates you.
Oh, okay. I don't drink, by the way.
And that's everyone who has alcohol. You get dehydrated.
Oh.
And so dehydration is a trigger for a crisis. So if you are going to have alcohol, everybody needs to be responsible. But with sickle cell, you need to be aware of that and make sure you have your extra fluids, water, to make sure you don't go dehydrated. But alcohol dehydrates you, so that can cause a crisis. And we're not saying you have a glass of wine and you have a crisis. No, it's different for different people. But it's about, again, being aware and looking after yourself, making those informed decisions. Cool. I say to young people going to uni, your friends need to know that you have sickle cell anemia. And so when you go out for a rave, I don't know what it is they do these days, you need to have your coats. You need to have your coat. You need to stay warm, and you need to drink water. But yeah, they can drink, but within reason.
And that's a problem for, you know, even for myself. And when you go through that teenager stage, you know, you don't want to tell your friends you got a disability. You know,
don't want to be different.
You just want to be cool, and especially when you got something where people look at you and you Mr. Cool, and the next thing you know, you can say, "Oh, by the way, I've got." Nah, you can't tell them, you know. And it's
but people are really good.
Yeah,
people are inherently good.
But
I say to young people, if you tell your friends you've said you've got epilepsy, if you tell your friends, they will generally look after you. They'll be like, is this okay with you? Should we, you know? So you're better off letting your friends know in your little circle that 100%. Actually this is what's going on, and they can support you.
Okay, no, 100%.
And that's why we're doing this talk, isn't it? So people feel confident.
I've had it myself. My friends are like, "What are you doing? Oh, I'm just checking if you're okay." But you don't talk to me properly anyway, you know what I mean? So I remember I had a seizure one time at school in the gym, in big sports all in front of everybody. It's like everybody cared. It's very, very true. Now, I'm going to bring up the dreaded word. I don't know if we're going to get booed off YouTube. We're saying this word COVID-19 all the time now. Now, did your department absolutely were on your edge when COVID hit, or did sickle cell didn't make no difference, or was that an underlying condition? When there's an underlying condition,
it's really interesting. So when COVID started, obviously nobody knew what it was, what it was doing, what it could do. But by extrapolation, we kind of reckon, right, if this is causing severe respiratory illness, then somebody with sickle cell anemia will be high risk. Because the chest is so important. And so patients who have sickle cell anemia were put on the shielding list. They all had to shield. So they were part of the group that had to shield and not come out, you know, even the adults, you can't go to work. And so what we found, even though we were very, very anxious, was that we didn't see them in hospital with COVID, definitely not in pediatrics.
Yeah.
A few adults did have COVID, and some of them did unfortunately not make it, but they were mostly the adults who had other problems, you know,
as well.
High blood pressure, kidney problem, you know. But in pediatrics, especially in my area, we did not see them in hospital. Part of it, we think, is because they were shielding, so they were very careful. They were like, "I'm not going out there. I don't need to get this." So that's what happened. So they were fine, and they were among the group that got, because they were vulnerable. Their vaccines. The older ones at least got their vaccines really early on.
Brilliant. And what we've encouraged through further podcasts what we had about concerning COVID is, I want to encourage people, if you just listen to this now, be wise. You know, it's not just about just maybe getting the vaccination, just carrying out, nothing happened. Still have procedures, still keep a distance, still wash your hands, still cover your mouth. Don't cough in people's face. I used to get told off. Yeah, if you ever cough, cover your mouth. You know what I mean? Get the tissues out. Let's be wise, guys. You know, I'm in the studio now. I still have my sprays and this around the place and disinfectant things around the place. Let's be wise and let's make this practice. It's not a bad practice, a good practice of cleanliness.
Yeah, so before COVID, people with sickle cell anemia always were encouraged to get a flu jab anyway. I don't know if epilepsy do the same, but with sickle cell, so before COVID, they were always encouraged to get a flu jab. So it's just, you know, as one parent said, it's just another jab. And if it's going to protect me some way, then I'll do it,
Now, let's get into the support organisation. Oh, before we come out of this, because we did touch about thalassemia, and we did touch on that a bit. And I actually grew up thought it was just a Caribbean disease because I was only in a Caribbean community. Now, West Africans, you know, dare I say, 100% African, Now, when you get to Afro-Caribbeans, we're not 100% African, you know, and we do have, you know, like myself, whether it's Irish, Scottish, you know, myself, I got Portuguese, French as well in my bloodstream. We do have thalassemia as a curveball. You know what I'm saying? That could easily happen. I know. Is that something that, especially Afro-Caribbeans, we need to be aware about that and mixed relationships as well?
Yes. So you're absolutely right. I think one thing I will say is I think the way the world is now is such a mix that unless you go and really trace your DNA, nobody, I don't think anybody's pure anything anymore. You'd be pleasantly surprised. If you went and ran your DNA, you'd be pleasantly surprised. I'm sure we all would. That's the first thing. So you can't, I suppose the clinical relevance of that is you can't assume that, I'm Black African, therefore I won't have, no. And we do have Black African, people of Black African heritage who do have thalassemia, and you do have it there. But again, to summarize, thalassemia is another red cell disorder. It's also a hemoglobinopathy, so they will also be looked after in my clinic, and the same people who look after sickle cell anemia would generally look after thalassemia. Okay. So it's also picked up on the Guthrie. It's also picked up on that blood spot test, and it's pretty similar in the sense that you can be a carrier and not have any problems, or with carrier or trait. Or if you then have a baby with somebody else who's carrier, then you can have a child with it. Again, women are screened. So most women who've had one baby will know what their status is. But if you've never had any babies, it's worth going to check. If you're a carrier, you can have a mild anemia. But otherwise you live a normal, healthy life. But if you do get the condition, then it can be really problematic. I mean, again, it's like sickle cell, it's a spectrum. There are different types of thalassemia. Right. But at the worst end, they can have they need to have regular transfusions, pretty much. And they don't get pain as a crisis, but they need regular transfusions from the word go. Now, talking about transfusions, I just want to throw in there, I don't know how many people have realized, but there is a national blood shortage at the moment. And all these blood disorders, sickle cell, thalassemia, they rely heavily on blood. So one of the treatments for sickle cell is regular blood transfusion. So if we have you on the medications we have, and you're still having too many crises, or if we do, there's a special screen we do, it's a Doppler scan that they do on the side of the head. It's like when a woman is pregnant and you get an ultrasound scan. They do it on the side of the head for children up to 16, and we're able to measure the blood flow into through the brain, and it tells us if there's a narrowing, which means the sickle cell is already affecting those vessels. Yes. So that means, you are even at a higher risk than the average person with sickle cell. They get that done. It's called a transcranial Doppler, TCD for short, and they get that done every year from birth. But if it's abnormal, then they have it 3 monthly. One of the biggest treatments is blood transfusion every month. So every 4 weeks, these children come in, they have to be pricked, have to put a cannula in, and have to have a blood transfusion. The whole premise of that is...
What's working? Children are getting blood transfusions like it's...
every 4 weeks. And the whole premise of that is you're giving normal, non-sickle blood that then goes in and dilutes the sickle blood, and so they shouldn't have the complications that the sickle is giving them.
Man.
So those kind of children will never have a crisis. Well, will almost never have a crisis because they've always got that donor blood in them. But it's very important. I just want to flag that black people need to donate blood, please.
Okay,
go and donate blood.
Right. This black people blood thing now, yeah. So
it doesn't cost you anything. It doesn't cause you any harm, and the patients who are black are more likely to match with black people.
Yeah. So this is the thing is now, I don't want to get too controversial with this now. So we're all human race and we all got the same blood. Look at my blood, let me cut it. It's the same blood.
So it's not, it's, on a basic level, it's the same. But when you break it down to a more molecular level, it's not the same. There are, so for instance, do you know what your blood group is? What's your blood group? Do you know? Find out what your
guys,
know your blood group. There are four major blood groups. So your A, your B, your O, and your AB.
Okay, cool.
I'm just going to stop there. Yeah. But even then, in those groups, you have subgroups.
Yeah.
And you might match on one level, on the top, on the higher level. Down. Yeah. And the evidence is you'll be quicker to match with somebody of the same ethnicity as you, for obvious reasons, got similar DNA strands, than somebody who's not of the same ethnicity with you.
Wow. Okay.
Black people need to go and donate blood.
Okay, I actually, it sounds kind of weird. I actually thought type A is type A. I know I do.
It's more than that.
Yeah, it's more.
That's putting it really mildly. So I just needed to throw that in there because at the moment there is a shortage, and everybody who needs blood is at risk. But people with sickle cell anemia is a very blood-heavy specialty.
Yeah.
Like I said, we treat some children, some adults with transfusions every 4 weeks. And then if you have a crisis, like a chest crisis, what we do is something called an exchange transfusion, where we take blood out and then we give you blood. And the whole premise is the blood we're taking out is the sickle blood and we're giving you non-sickle blood, and that sorts things out. So we all need to be donating blood. I needed to get that in there.
No, absolutely fantastic, because we have seen campaigns for black people.
But you've ignored them.
It's like
they're not talking about me. You'd be like, that doesn't have anything to do with me.
What are you on about, man? There's blood.
Every drop of blood we use is somebody who's gone and sat down and given their blood. We should all be giving blood.
So how do we? I must admit, because my epilepsy, I was taking medication for a very long time. So I think I've stopped now for a number of years. So it's something that I can
done. Yeah.
So it's something that I can probably seriously, because obviously when I was on the medication, this is that. You can't do it.
So if you go to www.blood.co.uk,
as simple as that. www.blood.co.uk. Can't get that wrong.
Or if you just googled how to give blood NHS, it will be all in your face.
Okay, cool, brilliant. That's fantastic.
And there's a centre near everybody.
Yeah. And it's fantastic to hear you say that, as much as it's uncomfortable.
You know what? Your red cells, they last about 3 months so your bone marrow is constantly producing red cells, so your blood. Yeah. And every 3 months, so every red cell lasts about 90 days and then it dies off, and your bone marrow is constantly keeping it going. So it's not the same blood you had 3 months ago. It's not the same blood. So if you go and give blood, your bone marrow will just replace it. You don't miss that blood. You don't miss it at all, unless you're anemic, which they would check before you have a blood test. But we should all be giving blood.
100%. And in the future, guys, I would love to again have you back on. I got a friend of mine who's got sickle cell. We can look at giving blood campaigns, because you've brought it from a different angle. I just think of somebody having a car accident and having a transfusion.
I suppose that's what you know about.
Yeah, that's what you know about. You don't really see applying, and it's okay saying there's injustices out there, guys. But the thing is, how we can take care of our own is to give blood. I think that's definitely really, really, really important for us to do, guys. Basis of that, I'm not saying because of that knowledge now, it's going to help out people only, but just I didn't genuinely realize that it was blood was that detailed.
I have about 20 patients in my service that I transfuse monthly, that we transfuse monthly. So we're talking about a good, each patient uses about 2 units, and the bigger you are, the more blood you need. So roughly 2 times 20, that's 40 units I use at least every month, and that's for the regular transfusions. And then if you come in unwell for an exchange transfusion, sometimes we use 3, 4, 5 units for one person. So it is really important. We need the blood is doing a good job. And then you have your accidents, your cancer patients. My cancer patients as well use a lot of blood. So yeah, it's so important. But sickle cell particularly, it's one of the mainstays of treatment.
Wow, guys. On that note, guys, I know there's a lot more we can go into, but I knew this actual one will be a bit longer than the average bear that we planned, because I knew it's an important subject for our community. We've gone from understanding sickle cell, dealing with a couple of myths of malaria for me as well. Still, we traveled over to the facts of how it comes about, how it looks, a sickle. It sounds so. It tells you in the name sickle, and it actually how it affects people. What crisis is, that's just crazy. I don't know how I could cope.
It's horrible. So a person with sickle cell anemia in a crisis is horrible, because you see a grown man screaming until they can't scream anymore.
But it's not knowing when the pain's going to hit. That's the part that'll mess up my head.
That's the frustrating part, especially for the young people.
Because you can't commit. You know what I mean? But you can't, because you commit knowing that you can mess up, and it's just like...
exam time, GCSE times. And we know that stress is also a trigger. My young people, you could have a fight with your partner and you could go into a crisis because of that stress. Wow. Or just GCSEs, or... so it is difficult.
It's real talk.
But things are looking up.
Yep.
That's why this talk is important.
Yep.
The new drug that NHS England has commissioned.
Yep.
If people go online and just Google, can you tell it's sickle cell? That gives you a lot of information.
Brilliant.
And that link takes you to the training that you can do online. You can read the doc. So there's the one charity for people with sickle cell is the Sickle Cell Society. Again, if you Google www.sicklecellsociety.org, there's loads and loads of information on there. The positive is that things are getting better, but we need to do more. We need to do more. And like you said, with COVID, we were able to find a vaccine for COVID. So I'm sure the treatment for sickle is out there. We just need to commit. We need to commit to looking for these treatments, which, again, costs money, investment, but it's doable.
No. Absolutely fantastic episode. Bear in mind, guys, I don't like watching programs like ER and all them programs. I'm the last person. Ask my wife. I am not the guy to watch it. So go through this, and if you see me frown and flick up my face and whatever, please forgive me, guys, because that's my real raw image of how it makes me feel. I'm not a blood man, but I've had a lot of blood taken at me because of blood test going through my years, so I'm kind of used to it, because I don't know my blood type from the top of my head. I know I'm
sure it's been done.
1,000 times.
You need to go and donate blood. You know your blood type for free.
I'll definitely get it, because I get MOT'd every year.
So they'll do it for you.
So I'll do that, no problem. So guys, you hear it first. If I pass the test, you'll see me do a selfie online, so Instagram to prove it. See, I'm saying it now, so everyone's gonna be holding me to it now. But no, it's on a serious note. For the youngers that are out there, I'm a big guy. I've lived my life, but to make a young child have a better life, but they can play, enjoy the life with their friends. Just that alone, you know what I'm saying? That's actually not spiritual manipulation, but that's just real talk, and you're gonna help a life. So 100%, man. But listen, amazing talk, amazing conversation, and thank you for coming on to my Ed show on the Affinity Xtra, where we celebrate gospel music of Black origin, but we're here to talk the real talk when it talks to subjects in that area that we're not talking about. And I'm afraid sickle cell is definitely one that we're not talking about. You take care, and thanks again for listening, guys. Bless you. This is Roger, over and out.
Hey, this is your bishop from Rock Solid. Thank you so much for watching us on YouTube. Thank you so much for clicking and subscribing, and also sending these videos to other people as well. We are so hungry to get your support. So remember, check us out on our website, and also check us out on Insta, and wherever you want to find us on Spotify. You can play us all day as well. And just make sure that you are supporting this channel, that we are developing our agenda towards music of Black origin, and that is gospel music with a message. So please walk with us on this journey. Bye now.